Welcome back to Hannity. So tomorrow morning, President Trump will travel to Capitol Hill to meet with Republican lawmakers about the GOP's plan to replace Obamacare. Earlier tonight, during his rally in Kentucky, the president, well, he said this.
Finally, we want a very big tax cut, but cannot do that until we keep our promise to repeal and replace the disaster known as Obamacare. Obamacare has been a complete and total catastrophe, and it's getting worse and worse by the day. And yet you watch the fake media, the fake news, and they try and build it up. It's a disaster, fellas. It's a disaster.
All right, joining us now is the Speaker of the House, Paul Ryan, is with us. Mr. Speaker, always good to have you. Thank you.
Thanks for having me, Sean. Thanks for having me, Sean. Good to be with you.
So you want to vote, we expect to vote Thursday on the health care bill, and I saw progress, a lot of progress on Friday. Let's start with the good news. And, for example, the White House, for example, the option to impose work requirements on Medicaid recipients, block grant Medicaid. I know that was important to the Freedom Caucus members. And also the measure, which I think is interesting, is that the White House and House leaders are also increasing the tax credits. Some people don't like that aspect of it. Where do you stand now? Do you think you have the votes right now to pass this bill?
Yeah, I feel very good, because what we've been doing this entire process, Sean, has been listening to our members, finding out where the consensus is, and making improvements to the bill as we've gone through the legislative process. As you know, it's a four-committee process. In the Budget Committee, there was an effort to say, let's look at work requirements. Let's look at even more federalism for Medicaid, something very important to conservatives. There already is a per capita block grant, but some governors were saying, let me just take the whole thing in a block grant, and that's what a lot of conservatives were asking for as well, and that's something we figured out we could get this bill to do. We always have to make sure that every change we make conforms to the Senate rules, which we have to play by, to make sure that it can't get filibustered. And so that's what we've been doing. So all these changes that have been added, we're doing to make sure they're done in such a way that it can't get filibustered. We feel really good where we are. So a lot of members have brought a lot of good ideas to the table. And you mentioned the last one. That's something that's also important to the president. The president has said, let's see if we can add to the people who are getting assistance, who don't get health care from their job, who are older, maybe in their 50s or their 60s, to make sure that they're in a good place as well. So we're doing even more assistance there, more federalism, work requirements for Medicaid, for able-bodied people. So these are the kinds of things that get Republicans in a good place. We feel very good. Our members have been working really hard at this, and we realize that this is coming to the point. The president's going to do something in Kentucky tonight. He's coming to talk to us tomorrow morning to give sort of a rally to our members to get this done, because you know what? We all promised this. We all said we would repeal and replace Obamacare if you give us a Republican president, a Republican House, and a Republican Senate. Well, we have that now, and we're working very closely with the administration. I got to tell you, Sean, I'm really, really impressed with the president himself, rolling up his sleeves, getting involved, listening to members, brokering compromises, getting us on the same page, and getting to this place. So I feel very good at where we are, and we're going to move this to the House and then go take it on over in the Senate.
Why is so much emphasis put on the CBO? They said Obamacare would have 24 million enrolled people. Right. They have 11. I mean, it almost seems like an effort in futility to keep going back to them when they're so wrong so often.
It's all about the filibuster, Sean. It's all about the way that the Senate law works with the Budget Act, which says the score, as scored by the CBO, must meet what we call reconciliation instructions. And so to conform with the Senate rules, to be able to reconcile this bill and block a Chuck Schumer filibuster, you got to have a CBO score. That's how it works, and those are the rules we're playing by. Those are the rules that they are.
All right, let me then move on. You saw the hearings today with James Comey. To me, the big news that came out of this is both Comey and Admiral Rogers both confirmed what James Clapper had said, and that is, okay, there's no evidence that any votes were altered or shifted or changed in any of the swing states that mattered in this election. The media is not focused on that. But we had reporters on this program, John Solomon and Sarah Carter. They're both saying, in fact, there was surveillance of the server at Trump Tower. There was a FISA warrant about the overall Russian investigation, not about Trump. And while he's willing to admit one investigation is going on, he's not willing to admit another in terms of leaking. He says, well, it's common practice. We don't acknowledge that. Is that troubling to you?
Well, look, that's why we have an Intelligence Committee investigation. So the point is, the president asked for this, and we already had an Intelligence Committee investigation going on before all of this. And so that's why I think Chairman Nunes and his ranking member and Chairman Burr over in the Senate and his ranking member are going to see to the bottom of this and get through everything all Russia-related. I didn't watch the hearing because I've been actually busy doing my job, but I've had briefings from Comey. I don't think we learned anything new here, and it only confirmed what we've been saying all along. But at the end of the day, we'll get to the bottom of all of this stuff, the questions you just raised, with the Intelligence Committee investigation that's ongoing.
Last question, back to health care. Is the Freedom Caucus on board? Well, have you talked to them? Because Dave Bratt earlier today said 40 members were not going to vote for the bill, and Rand Paul said the same.
Yeah, well, I've spoken with many of them. I haven't spoken to every one of them. I talked to a lot of members. We've got 230-some members here. But the Freedom Caucus members that have had this vote in committee have already voted for it. One of the ones that didn't vote for it in the Budget Committee has now come out in favor of it since then. So we've had Freedom Caucus members already voting for it in committee, and one of them who didn't is now in favor of it because of the work requirements, because of the additional layers of federalism. So I've spoken with a lot of Freedom Caucus members who are voting for it. We also have the largest conservative caucus here, the Republican Study Committee. That's the biggest conservative caucus we have in Congress. Their leader and their key members came out in favor of it with President Trump in the Oval Office on Friday. And so we're making tremendous progress. We feel very good. And it's because we've been negotiating and listening to one another, improving this bill, making refinements to it so that we get to the sweet spot of a consensus bill that can pass. The key, it doesn't make any difference if you can't repeal and replace it, if you can't pass it. So we're getting a bill that can pass, that repeals and replaces Obamacare. Okay. And this is just one piece of the three things we're going to do.
And you are confident that the bill in the Senate will be similar? You've been...
Yeah, the bill in the Senate will be similar, but we want them to improve it if they can. We think, because their rules are a little different once it gets over there. So if senators can make improvements to this bill without jeopardizing what we call the Byrd rule, meaning a filibuster, that's great. We want them to improve this bill if they can.
All right, Mr. Speaker, I know you're busy. Thanks for being with us.
Thank you, Sean.